Hey, what's going on? We're here to talk about shin splints, which are also known as medial tibial stress syndrome. It can strike essentially at a moment's notice. What that basically means is that it kind of sneaks up on you. Generally speaking, you have some dull, achy pain, and after a while, it turns into hot type of pain, essentially at the front of your legs or on the inner aspect of your legs. And this can easily disrupt your routine. It can threaten your fitness goals. And essentially, for every fitness enthusiast who's ever felt a twinge during a run or during a workout, or who's ever suffered discomfort long after you cross the finish line, you understand that shin pain can be paramount. And so, basically, what we're going to be talking about today is the need for addressing shin pain in a sense of being in high intensity workouts or working all season long. And from that aspect, you're basically starting to get pain along the inner aspects of the front of your legs, but you just don't know what it is or what it's being caused by. And essentially, those are typical signs of actual shin splints. And so, recognizing and understanding the symptoms, which are primarily caused due to overuse, but that's not the only reason, it's not just for the pros, it's pretty much for every fitness enthusiast out there. And if you are about to take on any type of new activity that causes a lot of stress on your legs or increases the amount of time that you spend on your legs, you should definitely understand shin splints. And so, with that being said, let's get into it. It can manifest itself, generally speaking, as dull, achy pain on the inner aspect of the leg or even on the front side of the leg. And from there, it can over time continue to develop into a whole lot more, literally just being more pain in the area, more tenderness in the area, and even swelling in the area being right at your shin bone on your tibia. So, right there at your shin bone at the tibia, we have connective tissue that goes from bone to the connective tissue, which we appropriately call the fascia, which also connects to the actual muscles within the area. And typically, these muscle groups are the flexor hallucis longus, the tibialis posterior, the soleus muscles. And when these muscles are overworked, the stress load that's on them naturally gets transferred over to the actual fascia, which then gets transferred over to the bone. And generally speaking, we start to see some changes when that muscle stress load gets transferred to the fascia. And so this normally happens with repeated or repetitive activities, with bad shoe gear, which is major. Whenever we increase our stress load really quickly, such as those participating in like military regiments and things like that, whenever we have chronically tight muscles, is another great category. Whenever we have a biomechanical issue, such as overpronation, and as well whenever we have a foot that's in a plantar flex position and has to do a lot of work to dorsiflex. That's in the biomechanical aspect that we'll talk about in a bit. And so, if this pain is consistently at the front of your lower leg or at the inner aspect of your lower leg, you certainly should see a physician. Okay, preferably a podiatrist that's based in sports medicine that can help you out. So, one of the hallmark symptoms, once again, is generalized pain up and down the inner aspect of your shin bone or at the front side of your shin bone. This, in particular, separates itself from stress fractures of the actual shin in that that pain is pinpoint, so it's not up and down the actual shin. You'll feel it in one particular area. If it gets worse enough, the shin splints, that is, you'll start to have swelling and increased tenderness within the actual muscle belly going into the fascia as you move from the muscles onto the fascia and onto the actual bone itself. And there's a lot of inflammation that's involved with it as well. And if ever this is the case, this is definitely time for you to actually stop your activity. Why? Because of the fact that this progressively gets worse. It does not get better with time and continued stress on the area. And so, generally speaking, we are looking to place you into a walking boot of some sort, decrease your activities, supplement you with anti inflammatories as well as with massage therapy. Also, sometimes even physical therapy may be needed. But more importantly, addressing the actual cause of your shin splints is paramount. So diagnosing shin splints and recognizing the symptoms is definitely the initial step, because it's multifactorial, and because there are so many different reasons for it. That necessitates that you actually have it assessed by your sports medicine podiatrist. Most people who have shin pain generally treat themselves or have some treatment done without, unfortunately, an appropriate diagnosis as to why it actually happened. So, if we can diagnose why it is actually happening, then you can get an appropriate treatment for you, which may differ from somebody else who has the same exact shin issue, same exact shin pain, same exact area, but the cause can be different. Such as if ever we have tightness within the musculature, that cause is totally different, and the treatment for it is totally different than if it's because of a biomechanical issue. If we have an issue with increase in a rapid increase in exercise or the stress load, that cause is totally different than, once again, muscle stiffness. So we treat them differently. And so preventing and managing shin splints often takes, of course, a doctor's visit and quite a bit of time. And with that being said, proper equipment is needed for your actual treatment. Like we said before, sometimes we place people into a Una boot, sometimes we place people into a cam boot, sometimes we have them in shin sleeves and things like that. Your footwear also makes a big difference. We want to decrease the amount of stress load on your actual foot and legs with the use of carbon fiber orthotics, which is a game changer. We want to obviously decrease the amount of pronation, and even your shoe gear. We want to make sure that we are in shoe gear where the heel isn't too high and it places your forefoot into a plantar flex position while you're running, jumping, and things like that. We also want to look at how much you've been increasing your activity week by week so that we can modify that if that's the case. And once the actual shins have calmed down, next, we want to go to strengthening the muscles. If the muscles are weak and overworked, we want to go into strengthen those muscles. And prior to that, massaging of those muscles may potentially be a treatment plan for you too. And so the rest of recovery when it comes to shin splints is certainly one of the most important factors in overcoming it. The rest, that is. And when you're speaking with your doctor, it's very, very important that you have a game plan and a roadmap to recovery actually worked out for you. Without that roadmap, it's easy for us as athletes to kind of veer off track. And so, whether you are starting off with rest, ice, compression, elevation as like your first line of defense, and you move into over the counter medications such as NSAIDs or anti inflammatories, or even if we have steroids as well, because steroids can be quite helpful and quite useful when it comes to this particular injury, or whether we go into physical therapy, whether we go into having time off, massage therapy is useful as well. Whatever it is that we do, um, these these factors, or should I say, these treatment modalities, can help out in terms of flexibility, in terms of rest, in terms of calming down the inflammation in the area as well. And so, some of the alternative treatments that help out quite a bit are the use of massage guns, foam rollers, massage balls, lacrosse balls, and even sometimes some of the tools that we have in the kitchen, such as a rolling pin. They can help out tremendously in terms of loosening up muscle and also helping to loosen up fascia and remove fluid from fascia as well. But ultimately, your first step is to seek medical attention, get to your sports medicine podiatrist so that the actual diagnosis can be accurate and the reason for your shin splints can be assessed as well. So that's number one. Number two is to have a great roadmap placed in front of you so you have something that you can adhere to. And number three is once you're done with the actual shin splints, an actual preventative program in terms of strengthening and in terms of workout modifications and things like that, as well as orthotics within shoes if that's necessary and shoe gear changes. So, in conclusion, shin splints, yeah, they truly can be the thief of your performance. They can ruin your entire season if you allow them to. And with this information, we understand that we don't have to allow them to. They can sneak up on you when you least expect it, as your season's going pretty great. But by being aware of the symptoms and being proactive in your self care, you can easily prevent it from derailing your passion, or derailing your fitness passion, should I say. It's all about the balance. So push your limits for sure, but always listen to your body. Listen to what your body's telling you. Just make sure that you're equipped to be able to handle the demands of your actual sport and your actual favorite activities, whether that's use of massage guns, carbon fiber orthotics, typical orthotics, whatever the case is, access to your sports medicine podiatrist. Just don't let shin splints set you back because you don't have the resources. The resources are definitely here for you. They're definitely around. And so the ultimate takeaway is for you to be an athlete every day. In the same breath, be aware of your body when your body's telling you that it may need a break, that it's injured, or if anything else is going on in your personal life that will affect your actual active life. And just take it easy overall, have fun, and enjoy yourself. So, this is Dr. Donald Harrison talking about shin splints. Come on into the office and we'll definitely help you out. Take care. Bye bye.